Hi, I'm Michael, and this is California. And right now, there are millions of Americans struggling across America financially. With unemployment rates so high and the looming second wave of the pandemic, many people who are without income and are concerned about their health care are enrolling into something called low-income health insurance, or as it's called across the country, Medicaid. Now, many of these people happen to be older Americans, especially because this is the group that is hit hardest by the layoffs and the pandemic. And one of the biggest concerns that we hear on a day-to-day basis in our offices from these older Americans is that they are concerned about the state taking their house, taking their car, or taking their assets after they die if they enroll into Medicaid under something called estate recovery. So today we're talking about Medicaid Estate Recovery and how much it affects seniors and their estates and their families once they die. But before we do that, if you like this information, if you find it interesting, if you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. So first of all, what is estate recovery? So estate recovery means Medicaid, the federal low-income health insurance program, seeks to recover a payment from the individual estates after they die. Now, although it does vary from state to state, in some states, Medicaid has the option to recover payments for all Medicaid services provided to individuals. In some situations, money left in trust after a person dies may be reimbursed to Medicaid for the services they received. And states may even impose liens on real property during somebody's lifetime if they are permanently institutionalized. But there are limits to how much Medicaid can reclaim, so they will never collect more than the value of the assets owned by the Medicaid member at the time of their death. And they will not collect more than Medicaid paid on behalf of the member. And they cannot try to seek reimbursements from children or other family members after the deceased Medicaid member is already deceased. Now, things that count as estates can really vary, but in this case, we usually are talking about houses, mobile homes, cash assets, cars, and jewelry, and similar things to that. Now, the estate recovery only applies to Medicaid recipients who are 55 years or older. So for seniors who are considering enrolling into Medicaid to help them pay for their medical costs, the estate recovery is an important consideration, especially because the cost of medical services can be very, very expensive, especially for things like end-of-life care, nursing facilities, and community home-based services, let alone prescription and hospital care. The state sees recovery of these assets as very, very important because states like California, who have medi-cal, which is the Medicaid program in California, they use the money for the estate's recovery program to help fund care for other medi-cal recipients. So again, estate recovery only applies to Medicaid recipients who are over the age of 55 years old. And Medicaid provides health care for individuals with incomes below 138% of the federal poverty level. So for a household of two, that would be income below $23,791 a year. And this amount can change for children who are under the age of 19 or for adults who are over the age of 65 years old. Now, Medicaid is a comprehensive health care and provides coverage for things like hospitalizations, doctor's visits, medications, lab works, and a whole lot more. Additionally, Medicaid can work with Medicare for seniors over the age of 65 to help pay for some of those costs that are not covered by Medicare. And for people over the age of 65, in addition to income limits, there are also asset limits, which are generally around $2,000 a year. And so a person has to have below both the income and the asset levels to be eligible for Medicaid. But again, these numbers are in general and they can vary from state to state. Now, there's a lot of complication with estate recovery. So if you are concerned about your estate being affected if you apply for Medicaid, you should contact your local Medicaid office or your nonprofit health advocacy agency nearest to you, and they can guide you through the specifics of estate recovery for your specific state and for your personal situation. But in general, there are limitations on how estate recovery can work. So, for example, according to Medicaid.gov, they will not seek estate recovery from a deceased person if the spouse is still living in the house, if they have a child under the age of 21, or a blind or disabled child of any age. Additionally, states will not put liens on real property during the lifetime of a Medicaid enrollee who is permanently institutionalized when the spouse resides in the house, when there's a child under the age of 21, when there's a child who is blind or disabled, or a sibling who has an equity interest in the home. States have some flexibility with regards to what they should recover Medicaid monies from an estate. So in California, the Medicaid program, or medi-cal as it's called here in California, has extra restrictions put on it as to when they would be able to recover monies from a deceased medi-cal recipient, and this started all in January of 2017. So prior to 2017, Medi-cal was able to go after all assets owned by a deceased member at the time of their death. And payments would be owed for payments made for most services paid by Medi-cal on behalf of the recipient. And this caused a lot of financial pain to families, often at a time that is one of the most difficult times in their lives. And for Medi-cal recipients who died before January 2017, this rule still applies. Now, after 2017, Medi-cal became restricted by the types of payments that they could seek reimbursement from deceased members. The repayments would be restricted only to payments made for nursing facility services, home and community-based services, and related hospital and prescription drug services received while the member was inpatient, in a nursing facility, or a home and community-based service. Overall, Medicaid Estate Recovery can be a scary thing for seniors who need help with their health care, but have worked hard all their lives to have something to pass down to their family members after they die. Luckily, a majority of Medicaid recipients and their heirs will owe nothing after they die. But for those seniors who do have concerns about their estates being recovered by Medicaid after they pass away, it is important that they contact their local state Medicaid organization or nonprofit senior right organization that will assist them fully understand how the Medicaid estate recovery works with regards to their specific situation. Thank you so much for watching our videos. And I hope that you found them interesting or helpful or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments or questions, leave them down below. We love to see your comments and questions, and we'll be happy to make a new video or a new post as soon as we can to go over them. Now finally, we here at California, we know health insurance. So whether it's private health insurance or covered California or Medicare or Medicaid or Medi-cal or even health insurance for a small group, we know health insurance. Because I know it can be very complicated coming out of your work insurance and having to find private health insurance. Or maybe you're turning 65 and you're trying to figure out what are the best Medicare options that fit your needs as well as your budget. Or maybe you're coming out of a government program like Medicaid or Medi-cal and now you have to get health insurance on the private side. We can help with all of that. So if you have questions about your healthcare, leave them down below. We'll make a video for those as well. Now, other than that, I'm Michael, and this is California, wishing you a happy, healthy